We have approximately 10 locations around the city, and because of time scales and the time available to us, obviously we're not going to be able to visit all of those. So what we've done is we've chosen 4 sites to visit, and then we're going to do a drive by some of the other sites, and while we're passing them we will explain to you what happens in those various sites.
The Refuge is here since 1981. And we can accommodate 6 women and 15 children, and we're the only 24-hour refuge in the Western region. We also have an outreach service, and that's for women who don't need to use Refuge, but they do need support and information because they're in domestic violence situations, and we operate that service in the town and also in the county area. So we would have support available in towns like Loughrea, Portumna, Gort, Headford, Tuam. In a nutshell, we would have on average about 150 admissions for women every year, and between 200 and 300 admissions for children who are with their mothers. And the average stay would be around between 7 and 10 days. They may decide to leave their partner and get a legal order, so we would obviously accompany them through the court process and support them in that. Or they may decide to return to their partner, in which case we would look at doing safety planning with them and make sure that they were linked into their local supports and their local family supports as well for the children, particularly social work. And some women then move on, maybe homeless because of domestic violence, and they may need to access new housing through the local authority. So there would be quite a piece of work to be done there, and those kind of families would stay longer in the refuge, maybe up to 3 months, some of them. And that can become very difficult for them, obviously, when they have to live in such a small space. I suppose one of our key issues at the moment is the actual building itself. It's quite old. It's not in great nick. We actually have no cooking facilities for women at the moment, and Cope itself is catering for women through community catering, which is very lucky that we have that, but it's certainly not ideal for women with young children.
One of the big challenges that's come up is that at a national level the focus is on long-term housing. This isn't long-term housing. This is emergency refuge for women. So there's almost a singular focus at national level, at the Department of the Environment level, in that for capital funding now, it's actually about long-term housing, and that's to do with the National Homelessness Strategy, under which this is broadly looked at also. So I suppose it would be one of the things there would be to actually make to be able to make a case and an argument for. We've had discussions, preliminary discussions, and again the indication is, for example, earlier this year we put in under the long-term leasing the possibility of accessing properties through that, and because it wasn't long-term, it wouldn't be considered. So I suppose that's one of the challenges, to actually get an exception made to that the capital funding would be available for this emergency short-term, as opposed to, you know, as I say, what is the focus?
Yeah, the site here is incredibly important in the city. It's right beside, you know, the theatre, the courthouse, and so on. And you know, if there was the opportunity for a land swap or something like that, with a little bit of creative thinking, I think something amazing could happen here.
You know, women who are using the service, the kind of feedback we get from them, even though the building is in poor condition, is that the service is very valuable, and the kind of care they get when they come in from the staff is very valuable. And at the end of the day, it is the human connection, it is the listening, it is the validation, it is all of that that is, of course, the core of the service. So, I mean, obviously the building is an issue, but I would like to stress that I think that women, certainly from the feedback we've gotten, do have a positive experience when they come here, and it's important to say that.
I'm the housing worker here in Roylet Manor. It's a house for 6 men, so it's a 6-bedroom bungalow, and the project was started in 2007 in September, and it's been a very successful project. I think roughly 45 men have passed through this project so far, and most of them have moved on to their own accommodation and still hold their own accommodation. I suppose my role here as the housing worker is working with the men as they come in and helping them to put supports in place for them so they can move on to their own independent accommodation. And the time span for that is 3 to 4 months. Some move a little bit quicker, some take a little bit longer, but we use that time to prepare the men to move into their own accommodation. And so it's very much working with each man and putting a care plan in place, and really just looking at their own supports and what they need, and a very much an individualised care plan to help them to move into their own accommodation. And as I said, it's been very, very successful, and We have the resettlement team that then work with the men as they're about to move, and that's very much to help them when they move into their own accommodation, that they still have support when they're back out there in the community. The house, as you can see, is just an ordinary house, and we try and treat it like that. Some of the lads that have come through, they've moved on and made some big changes. Some of them have gone on to college. They would have had experience of rough sleeping this time last year and have moved from rough sleeping into the Fairgreen hostel and then into here and then onto their own accommodation. So 3 men I can think of just at the moment. 2 of them have got their own private rented accommodation, and 1 is hoping to be housed in January with the rental accommodation scheme. And actually 1 of them actually found employment as well. The main house rules will be very similar to, say, a lot of the other hostels, as in you can't drink in the house. That would be a big issue. And that's not to say you couldn't drink. We're not saying you can't socialise in the city centre, but as long as you come back and your behaviour is fine, there's no issue with that. That would be probably one of the main house rules. And similarly with drugs.
This is probably one of the finest examples in the country of the homelessness strategy working and getting it back. And albeit it started as a test, I think, here, was it? And so the challenge for us is to find a way to just keep this going as a fully fledged project into the future. But in terms of return for the citizen, this is really demonstrated itself.
This is the sitting room, the shared sitting room where all the guys spend time. And as you can see over here, you have there's a pool table which they can use, and so just flip this back, dartboards, and they have access to a computer here as well and some board games.
So Australia is a 13-bedroom emergency homeless hostel, and at the minute we're almost full to capacity. We have 1 bedroom free just tonight because somebody just moved out. But I suppose in the last couple of months our occupancy has grown an awful lot. Traditionally we would have accommodated 60 to 70 women a year, and we wanted some repeat admissions amongst that as well. But lately our client profile has changed quite a bit, and we've 3 families here at the minute as well. So as well as single homeless women, so we accommodate a mixture of both. As well, I suppose in the last 6 months we have a lot of young people presenting after leaving care. Traditionally our client user group would be roughly around the age of 50, so that would be the average age group before that. But now, like I say, in the last 6 months we've had 14 young people under the age of 21, so that's quite a change for us leaving care as well. So I suppose presenting needs that we might have would be mental health would be very common. Addictions, so generally alcohol and drug addictions, maybe heroin addiction is probably most common of the drug addictions. But we generally see more than one issue at one time, like most people would have, maybe family breakdown as well as, say, addictions or something else. The general age group would have been around the 40s, 50s, traditionally Irish women, but I suppose more so at the minute we're having more non-nationals staying as well. So.
Of older people is increasing, and
first of all, you're all very welcome on such a cold, miserable night. And I suppose just very briefly, this is the community catering service. It used to be the Meals on Wheels. We're very pleased with the facility. It was a bakery previously. We have much more room now, much more room to expand, much more room to provide quality meals. Currently, we have about 220 clients on our books. We have a 6-day service. We have 17 routes at the moment. Most of them are city-based, but we have 2 that are in the country. Those 2 they're delivered by a van driver, a person that's employed with us. All of the other routes are done by volunteers. So, as I said, it's a 6-day service, 15 routes, so we need a lot of volunteers. That's on the driving side. On the actual meals preparation then, because of the volume of we'll say, meals that we're now preparing, we are very reliant again on volunteers. So we have 5 or 6 kitchen volunteers along with the paid staff each day. Most of our clients are elderly people. A lot of them would come on our service, I suppose, initially maybe through having been in hospital and are recovering from either a fall or a stroke or whatever. Our main referrers would be the public health nurses, followed by, I suppose, social workers, family members and self-referral. As I said, we do a 6-day service. People can have the meals as often or as few days. We're totally flexible. We do a lot of work on, we'll say, special dietary requirements and customising the meal to a person's either, we'll say, dietary needs because of illnesses or because of personal preferences. And what they get is they get a main course and a dessert. And we charge €5. So I suppose our biggest challenge is really to be able to extend it to other areas outside of the city, to be possibly a hub provider maybe for smaller Meals on Wheels services in other towns that wouldn't have this type of we'll say, facility, and the needs from a health and safety point of view to have, particular, we'll say, regulations in place and all of that. What we have noticed in the last virtually 6 months, the number of little lunch clubs that are springing up in different communities. And it's so important, rather than eating a meal on your own. Like there's one now opened in Merview, there's one, like we're bringing to the Alzheimer's group in Merlin Park, we're bringing to Knocknacarra, and also to Vincent de Paul 2 days a week.
I've had contact with Cope before, but I think it's very, very important to actually see the facilities. You can get descriptions about what's going on, but until you see what's happening on the ground, you don't fully appreciate not only what's going on, but also the needs and the difficulties faced by Cope in providing the services they provide.
There is an onus on the government, regardless of whether the outgoing government or the new government's coming in, and the city and county councils to continue funding this service. And I can tell you, while I'm on the city council, I have 4 years left there in the current council, I will make very sure that anything comes up for the homeless services, which I have done in the past, that I will continue on to make representation.
I'm amazed actually at the amount of work that we've seen being done, from the very high quality of this community meals facility to what I have to say was an unacceptable standard in Waterside House, and that surely is a project we've now got to deal with and get that facility into a much better accommodation. But I must say it's wonderful to see the enthusiasm and the atmosphere of the various facilities that we visited and the total dedication of the staff. It's been a very useful evening for me, and it motivates us to try and help to get more money to assist in the wonderful work that's being done.
I think that when people think of homeless people, for example, they sometimes think only of shelter, but there are a whole lot of different services that are required. There are medical needs, there are also needs of nutrition. There's a question of having a decent meal and so on. And I think the value of Cope is that it drags a lot of the services together. If you want to get the best strategic result, you need, in a way, to draw it together. And I think you can do that when you have a central administration, when you have been able to say, look, the money will be gathered in like this. It will never be sufficient, but we will spend it on where we see or identify particular needs that are appropriate for particular sets of needs of people at different parts of the life cycle.